Okay, it's Tuesday's tip with Dr. Britt.
So Tuesday's tip is about how rotator cuff problems can progress. And most rotator cuff problems do not begin with a major injury. In fact, only 10% are due to an acute trauma. They often develop gradually, and there's a predictable cycle. It starts out with scapular dyskinesis, and that's where the shoulder blade does not move or stabilize properly. And that can happen due to weakness, injury, it can happen to posture. We see a lot of it. People round it over, and the shoulder blades don't move the way they should. That changes the normal shoulder mechanics, and that places extra stress on the rotator cuff. From there, it moves into a shoulder impingement. That's because that poor shoulder movement tends to reduce that available space. So if you're living like this or living like this, there's less space for that tendon to go through, and reaching overhead or behind your back repeatedly can pinch and irritate those tissues. And then once those tissues are irritated, you develop rotator cuff tendinopathy. So continued irritation leads to that tendon swelling and inflammation. Over time, that reduced circulation and repeated stress causes the tendon to weaken and degenerate. So think of a healthy tendon gradually becoming more like dried out beef jerky. And then you develop a rotator cuff tear. And that's where the weakened tendon begins to fray. And this can progress from a partial tear to a full thickness tear, and in severe cases, a complete rupture. However, the good news is that identifying altered shoulder mechanics early can help interrupt that cycle. And then treatment should focus on restoring shoulder blade movement, improving mobility, and strengthening the rotator cuff, not simply treating the spot that hurts. So don't wait for weakness, night pain, or difficulty lifting your arm to become severe. Give us a call and let us help you move better, feel better, live better, pain-free.